Let's talk about the common features of seronegative arthritis, or also known as spondyloarthritis. Okay, so it involves the spine. That's why it's known as spondyloarthritis. So what are the common features? The features are presence of family history, usually that runs in families because it's associated with a genetic factor known as HLA-B27. The patient will often be HLA-B27 positive. Usually there is a history of precipitating illnesses such as the patient can have inflammatory bowel disease. The patient can have a skin condition known as psoriasis, or the patient can have recent onset urethritis. So if the patient has inflammatory bowel disease, then the arthritis is called enteropathic arthritis. If the patient has psoriasis, then the arthritis is called psoriatic arthritis. And if the patient has urethritis, that's called reactive arthritis, and sometimes it may be called as Reiter syndrome when associated with the sexual exposure. What are the features? The features are spondyloarthritis. So the patient will have back pain. So usually low back pain. It's an inflammatory low back pain. The patient may also have arthritis of other joints, and usually that arthritis is asymmetric, and usually involves lower limb more than the upper limbs. The patient can also have something called sacroiliitis. There will be involvement in the sacroiliac joint, so sacroiliitis. And whenever there is involvement of joint, there will also be involvement of the structures associated with the joint, especially where the tendon inserts known as enthesis. So the patient will have enthesitis. So the patient will have low back pain, arthritis associated with enthesitis, arthritis of the SI joint. And along with those, the patient might also have eye feature such as uveitis, especially anterior uveitis in the eye. There will be pain and photophobia. There can be cardiac features such as aortic regurgitation. So those are the general features of seronegative arthritis. There will be family history, positive HLA-B27, history of precipitating illness such as IBD, psoriasis, or urethritis. There will be clinical features such as low back pain, asymmetric arthritis, especially involving the lower limb than the upper limb. The patient will also have sacroiliitis. The patient will have enthesitis, and the patient might have uveitis and aortic regurgitation.